अस्सलाम वालेकुम। डॉक्टर हुसैन बख्श कोलाची यूट्यूब चैनल से आज हम आपसे मुखातिब हैं। टुडे वी आर from the Dr. Hussain Bashsh Kolachi YouTube channel and community medicine lecture on natural history of disease. This is basically aimed to apprise the students of MBBS course and particularly the subject of community medicine. Natural history of diseases is a very common topic and it is a basic and fundamental concept in the public health. As a professor of community medicine and fellow College of Physician Surgeon, I have observed that most of the examination and most of the concept revolve around the natural history of the disease. So let us start without delay. So the contents are here. We will have the prevention of diseases, definition, introduction, phases of diseases, and conclusion. So let us start with the definition. The natural history of disease is the course a disease takes in individual people from its pathological onset, inception, until its resolution, either through complete recovery or eventually the end of the life. So you can see that how this concept is very important. And let us see the natural history of disease is sometimes said to start at the moment for exposure to causal agents. So the agent is one of the important factor in the triangle of the disease. Knowledge of natural history of disease ranks alongside causal understanding. What is the cause? You must understand is important for disease prevention and control. Both without understanding or complete uh, knowledge of the natural history of the disease, you can't apply control and you can't apply prevention. Natural history of disease is one of the major element of descriptive epidemiology. So basically it falls under the, and this is basically the course or the trajectory or the path of the disease from exposure to the host when host is exposed to some agents, and then there is a gap or there is a period, and then the disease process starts, and ultimately the three important aspects are recovery is there, disability is there, and death is there. So this is basically the main slide, and you should have. Now the terms are pre-pathogenic period. In the pre-pathogenic period, the disease originates, but the patient doesn't yet present clinical symptoms or changes in his or her cell, tissue, or organ. This phase is defined by the host condition, the disease agents such as microorganism, pathogen, and environment. Here, the role of the environment is very important. If it will favor to the agent, the disease will be more fast, and if it favors to the host, the disease will be very slow, or sometimes it is halted somewhere in the course of the disease. Incubation period versus latency period, it transmissible disease in transmissible or communicable diseases are like the flu. Nowadays, the super flu is there. We refer to this phase as incubation period because it is time which microorganisms are multiplying and producing toxin or disease elements. It is fast evolving and can last hours to days. So this is important from entry to the symptom. And primary prevention, before that, the latency period is basically from the uh, pre-pathogenic to pathogenic phase. What is the time? And it is important in the screening of the disease. If latency period is long, then the screening can be effective, or sometimes it is not effective because of the long latency period or gap between the pre-pathogenic and pathogenic. Primary prevention is important. Sanitary activities, a promotion of health, protection of health, and chemical treatment, suppose disinfections and others are part of the primary prevention. And health promotion means the knowledge is spread or the understanding of the natural history is important. Then we are coming to the secondary prevention. Secondary prevention, also called premature diagnosis or premature screening, is an early detection program. More especially, it is epidemiological program of universal application that is used to detect serious illnesses, in particular asymptomatic population during the period. So this is basically a screening, and iceberg phenomena of the disease are the hidden cases are discovered. Then is tertiary. Tertiary prevention is patient's recovery. Once the disease has appeared, a treatment is administered in an attempt to cure or palliate the disease or reduce the effect of some of its specific symptoms. The recovery and treatment of the patient is carried out both in primary care and in hospital care also. And then is the last part, which is quaternary prevention. Quaternary prevention is a very special type of the prevention in the group of sanitary activities that mitigates or entirely bypass the consequences of the health system's necessary or excessive intervention. This means that the quaternary prevention is one of the most important, which can bypass the primary, secondary. The conclusion is that natural history of disease refers to the progression of disease process in an individual over time in the absence of treatment. When you start treatment, then the natural history will not be completed and it will divert the progress or the course or the trajectory of the disease. For example, untreated infection with HIV causes a spectrum of clinical problems begins at the time of seroconversion, primary HIV, and terminating with AIDS and ULE. These experiments were done in the First World War and Second World War on the prisoners most to understand the disease, natural history of the diseases. So these are few references, and you can have query questions. So I think the basic concept, once again, I am focusing on the graph which I have already shown. This is important, and I think if you understand this, you have understood the natural history of disease. Dr. Hussain Bashkolachi will provide you the community medicine and public health topics through the video and presentation. Please like it, share it, and if you are a student, if you are postgraduate student, MPH, MPhil, FCPS, MCPS, or MD, I think these courses, even PhD, these concepts will help. And the general practitioner, they should also understand the natural history of disease and its link with the prevention and the treatment, as well as the recovery and the better life of the patient. Thank you very much, and please drop comments. And if you have any query, we are ready to answer this. Especially the ISRA students and other university students in Pakistan and India, they are having the same kind of the diseases as well as conditions, environments, so they can understand in a better way. Thank you very much. And with this, we are just ending the meeting. And thank you very much for listening and joining this video.